Namaskar and a very warm welcome to this edition of COVID Live. Let's talk health, gastro queries. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID 19 vaccination coverage exceeds 180 crores. India reported 2503 new COVID cases. More than 46 lakh vaccine doses have been administered in the last 24 hours. And the recovery rate currently stands at 98.72%. As COVID 19 continues to worry us across the world, some queries are on the go. People are speculating about various complications in health. In this program, we take your questions from Facebook and YouTube Live, and today we are joined by the very well known Dr. Govind Makharia, Professor, Department of Gastroenterology and Human Nutrition, All India Institute of Medical Sciences. Thank you so much for joining us, sir. Namaste and welcome to India
Thank you so
Science.
much. Thank you so much.
I'd like you to tell our viewers about the overview of the current gastrological scenario in India in view of the Omicron and the new strains. How do you prioritize gastro management in such times? Is there any specific protocol, sir?
So, as we know that the gastrointestinal diseases are very, very common in our country, and almost one third of everyone has some kind of a GI disease, be it a blotting sensation in the abdomen, be it constipation, be it diarrhea, be it difficulty in swallowing. So these symptoms are quite common in our population, not only ours, but all over the world. So GI disease are very, very common. And other disease, which I said that there's heartburn, that's called gastroesophageal reflux disease. That's also very common. So all of these diseases do occur with us. And if since we know we have a pandemic going on, is getting now much better. So Omicron will have some effect, but again, not much effect on GI disease. Those who have serious GI disease, the infection can lead to worsening of the GI disease.
Is on heartburn. What are the common symptoms and how does one explain heartburn?
Heartburn means once the acid, we require for once we take food, and for digestion of food, acid is required, and acid is secreted by stomach, and therefore this acid is very important for us. So what happens in some people, this acid comes up from the abdomen to the chest, and that leads to heartburn.
All right, doctor. And how does one cure this and realize that this is not something really serious, or is it to be taken seriously, doctor?
No, certainly, heartburn is very common. Almost every sixth person will have heartburn. Every sixth person will have heartburn called gastroesophageal reflux disease, and the treatment is drugs. We prescribe drugs. But again, I can tell viewers that few things are important to do. That if those who smoke should not smoke, number one. Number two, that they should not lie down till 90 minutes after meals. Avoid fatty food and avoid spicy food. Reduce your weight. If you are overweight, reduce your weight.
Right, doctor. What are the common symptoms in gastrointestinal disorders? How does one know that you are having these kind of disorders? If you could tell us a few symptoms, sir.
See, as it said, every organ will have its own symptoms. So in GI, uh, you will have most common symptoms is heartburn, the swelling in the abdomen, that's called dyspepsia, constipation, diarrhea, jaundice, pain abdomen. So these are the classical symptoms of GI disease. And I know GI disease is a long system. It also involves liver, pancreas, gallbladder. All of them together is called gastrointestinal symptom, gastrointestinal system. And disorder of any of these will lead to symptoms.
Right, doctor. The next question that is coming to us is if you could explain what endoscopy is and when is it done?
So endoscopy is a instrument by which we place through mouth. And this instrument, it has a camera, has light source. So we put the scope inside through mouth, in the GI tract, and examine inside the inner, because inner layer of intestine is examined, right? And if need, we can take biopsy from there.
Right, doctor.
So this test can be done through upper route, through mouth. This can also be done from the rectal route, from below, to look at large intestine. And also, now we can examine the whole.
And how common is it? How do we suspect the presence of fatty liver? If you could explain this in detail, because we have quite a few questions on fatty liver.
Fatty liver is very common. Almost 30% of our population have a fatty liver, right? So fatty liver mostly remain asymptomatic. Why it occurs? It occurs because of increased amount of fat intake, and also you take more and you burn less. Therefore, the fat accumulates in the whole body like obesity, but also in the liver. That's called fatty liver. Fatty liver almost always remain asymptomatic, but if you keep the fatty liver continuous for a long time, liver gets damaged, and that you can have a cirrhosis, which is a very serious disease. So it's always good to keep weight under control, and also keep diet under control.
Right, doctor. And what is cirrhosis and how can it be treated? You just said it can cause
I
cirrhosis.
think your questions are very diffuse, and going from so cirrhosis is a disease of liver, when liver becomes fibrosed because of multiple reasons, right? And it can be diagnosed once patient have symptoms like, if they have a fluid in the abdomen, if they have a distension or of abdomen, if you have pedal swelling, if you have if you have a vomiting of blood. These are signs of cirrhosis, but we want to diagnose them much before.
Right, doctor. We'll come to the treatment of cirrhosis and take some views from you later. Meanwhile, there is a YouTube question which is flashing. With your permission, I'm taking this. It is from Shivam, and he's asking about the causes of diarrhea, doctor.
Diarrhea has two kinds. One is called acute diarrhea, or other one is called chronic diarrhea. Acute diarrhea lasts for less than 4 weeks, and we know the most common cause of diarrhea is a GI infection, be it virus, be it bacterial. And these symptoms, I think all of us experience acute diarrhea, and they do resolve within say 2 to 5 days, right? But there are some people who have a chronic diarrhea, means diarrhea persists for a long time, and for that there are two different reasons. One is the small intestine, and one is the large intestine. So again, in the small intestine, the food is not absorbed, because of many diseases can lead to diarrhea. In the large intestine, there are multiple diseases which can lead to diarrhea.
Right, doctor. The same question from YouTube, he sent us another one. Please tell us about the causes of jaundice and how, because it is a very common disease, and how does one prevent jaundice, sir?
Jaundice is caused by, again, disease of liver and biliary system. So if liver is damaged because of any region, the most common cause is acute hepatitis. If there is a acute viral hepatitis because of infection by hepatitis A virus or E virus, can lead to jaundice. That's one important cause. If liver gets damaged for any region long term, that can lead to jaundice. And also, if the tube, which is called bile duct, it gets blocked because of tumor or stone, that can also lead to jaundice.
Right, doctor. The same person is asking us again that his grandmother had acute jaundice and she passed away, unfortunately. But why does that happen? What is the kind of treatment that should have been given to her? He wishes to know.
I don't think I can answer this question without knowing more about what all she had.
Right, sir. I'll get on to the next one. What is ulcerative colitis, doctor?
Ulcerative colitis is a disease where there's an ulceration in the GI tract, large intestine, and this is a chronic disease which occurs because of immune system activation, and the patient will have a bleeding in the stool. They will have a more frequency of stools. Means that's simply called bloody diarrhea, which comes time and again. This is ulcerative colitis.
Right, doctor, if you can tell us about some gastrointestinal diseases and what are these common diseases in the tract and how does one take care, especially in such
Yeah,
times.
I've already discussed about that. This is about dyspepsia, heartburn, it's called GERD, chronic constipation, which is mostly functional. So these are the common diseases.
If you could elucidate on dyspepsia, sir.
Now, I need to. What is specific question is that?
All right, I'll go on to the next one, sir. How does one diagnose gastrointestinal cancer early?
If you have a difficulty in swallowing, if you have bleeding in the stool, if there's a pain abdomen which persists, if somebody has jaundice in a high age group, one should think of GI tumors. But again, all these symptoms can occur because of benign disease. But any of these, somebody had difficulty in swallowing, if there's a bleeding in the rectum or bleeding in the stool, if you have pain abdominal persist, if there is jaundice, one should look for GI cancer. But I said again that these are more commonly done by benign diseases, which are curable completely.
Right, doctor. And there is a question coming from YouTube again that what is laparoscopic surgery and when is it done, sir?
Laparoscopy surgery can done for multiple reasons. Uh, Earlier we used to do open surgery, but in laparoscopy we can put multiple ports in the abdominal cavity, and we can remove stones from there. We can remove gallbladder, we can remove appendix, we can remove multiple other cancer surgery also done laparoscopically.
R- Right, doctor. How does one get to know if he or she has gallstones, gallbladder stones, and what is the kind of prevention that they need to take, the measures they need to take to kind of in food habits or otherwise?
I don't think food habit makes a difference. Gallstones are detected by using ultrasound. So, about 3% of our population will have gallstones, means 3 in 100 will have gallstones. Most gallstones remain asymptomatic. They do not lead to any symptom. But once the gallstone comes to gallbladder and neck, they can lead to abdominal pain. Somebody have abdominal pain, then we know there is a gall. Then you do test, do ultrasound, and then you see if there are gallstones are there or not.
Right, doctor. The signs for gallstones could be pain in the abdomen or they can be more signs. Could you elucidate on this?
Pain abdomen is the most important sign. There can also lead to jaundice.
All right, doctor. If you can tell us if there is any connection between gastrointestinal cancer and vaccination. Should one go for
Not,
vaccination?
not at all. Not at all. There's, there's no connection.
Right, doctor. The next question is again from YouTube and it comes to us from Madhu and she's asking, is an operation necessary for all gallbladder stone patients?
No, those who are symptomatic should certainly be operated. But those who are asymptomatic, those who don't have any pain, then the decision is case to case basis.
Right, sir. Can we take vaccine during gastrointestinal diseases and after surgery? That is one more
Yes,
question.
yes, yes, surely yes.
Sir, if you could tell us a little more about the gastro surgeries and how many kinds of surgeries there are performed, especially at AIIMS, and how does one kind of, you know, prepare people for them?
No, we do every kind of surgery. It's all dependent upon indications, but we do every kind of surgery at AIMS.
So, can you elucidate on the problem of alcohol drinking and smoking and how it can affect gastrointestinal problems more?
Alcohol is one of the important cause of damage to the liver. And if somebody takes alcohol continuously, that can damage liver. So that's one most important effect of alcohol in our body. Also, it can damage pancreas. It also affects small intestine. So alcohol has a lot of ill effects. And more importantly, to understand that alcohol has become part of society, but heavy drinking one must avoid.
What about smoking,
Regarding
doctor?
smoking, is mainly related with lung diseases that can damage lungs, and it can lead to chronic bronchitis. It can lead to chronic obstructive airway disease. It can lead to lung cancer. It also leads to oral cavity cancer. Also, smoking has other ill effects, including many other. It also predisposed to many other cancers.
Yes, doctor. What is loss of appetite and iron deficiency anemia? Does it indicate any serious problem?
Both can indicate serious problems. Yes.
If you can tell us a little more, doctor, what kind of serious problems?
The appetite has a multiple. As I told you, I cannot answer all the questions in detail. There are too many questions are there, and each question is a big topic. So, so appetite loss is caused by multiple disease. It could be occur because of diseases, inflammatory disease, malignancies, tumors, and also anxiety. Psychiatric disorders can lead to loss of appetite. At the same time, one have to look at everything in totality to see why there's a loss of appetite. Second is iron deficiency anemia. Again, it can be because of poor intake. Somebody is not taking iron properly. The diet has less iron, or it can also occur because of if iron is not absorbed from intestine.
All right, doctor. Osophagal cancer, if you can tell us what it is, because we are having queries on the that are flashing across on our website as well. If you can please explain what is osophagal cancer.
Esophagus is a food pipe. So once we take food from mouth, it goes through tube and in the in the stomach. So this is tube-like a structure which is there in our mid chest, and if there's a the tumor inside the esophagus, it can lead to obstruction. The patient will have difficulty in swallowing food. This is called esophageal cancer. So anybody who has a difficulty in swallowing must see a doctor as early as possible.
And how does one treat this, sir? Is it treatable in the first stages?
So yeah, absolutely yes, it is a treatable condition. So if there is dysphagia, it all depends upon what state the tumor is in. So we can do surgery, we can remove the whole tumor, we can do radiotherapy, and also chemotherapy. So it depends on what type of tumor is that. It also depends upon what stage of tumor is that. The stage and grade of tumor will help
ये
us
ऊपर आउट कर देता
decide the
स्टूडियो
form of treatment.
बस
Doctor, lots of questions coming on ulcers. Could you please tell us in simple terms
नेट
what is an
अच्छा
ulcer
स्पीड
and
अच्छी
how
है तो
does
आराम
it
से बढ़िया
affect the
लाइक ये लो
gastro system?
ये ऐड कनेक्शन
हाँ ऐड कनेक्शन कर दो
Ulcers means anything which.
नाम डालो
So
नाम
if
से
you look at my skin, so the skin is continuous, right? So but this gets injured, it forms ulcer, right? Ulcer is a loss of continuity of mucosa or skin. So that can lead to the ulcer can occur anywhere. Ulcers occurs in the GI tract, in the oral cavity, in the respiratory passage, right, in the urethral system. So where there is an inner layer, they can ulcerate, and uh, and the cause could be both benign cause, malignant cause.
Right, doctor. And what does one do if you suspect that you have an ulcer? You go to a doctor, and are there some kind of preventive measures that you can take to sort of mitigate it?
Uh, Again, every ulcer will have different mitigation strategy.
If you could give
I
us
don't think we
some
can generalize it.
example, doctor, I request you to give us some examples for the sake of our
Like for
viewers.
example, oral cavity cancer, which is common. So keep your mouth clean, keep your mouth hygiene appropriately. That is a brush the teeth properly. If your mouth hygiene is better, ulcers will be less common there.
So, is pancreatic pain related to gastro diseases?
Yes, pancreas is part of GI disease. Yes.
All right, if you can tell us how to treat fatty liver. We have quite a few questions on fatty liver. How does one treat it? If you can tell us in detail, I'd be so grateful.
So fatty liver disease, as I said, is a common disease. Almost every third person has fatty liver. Even in children, the fatty liver is becoming very common. And if fatty liver has no symptoms, so we cannot know if there is a fatty liver, somebody fatty liver. This is point number one. So we will not know that there is a fatty liver unless we do test. And the liver, fatty liver, if you leave it alone for multiple years, then it can lead to liver damage. And from there, there's no reversal. It can't come back. So it's important to detect fatty liver and more important to prevent. And the two major way to prevent is just like uh, is a balance between how much we eat and how much we burn. If we eat more, burn less, the fat will get deposited in the body. It will lead to obesity and also fatty liver. So both are not good for us. Obesity and fat both are not good for us. So if you look at so how do we do that? So restrict your diet. Don't take additional food which you don't need to take. Avoid fatty food generally, and do physical activity every day. At least 40 to 45 minutes of physical activity. Either you take uh, get a fast walk, you run, you do some kind of physical activity. That's important. And also, how do I know? Keep weight under control. So, what is my ideal body weight? It's simple to calculate. And take a simple formula. So, take your height in centimeter. Suppose your height is a 5 feet 6 inches. It means this is a 165 centimeter. And in that you minus 100. So 65. 165 minus 100 is 65. 65 should be your weight. So suppose your height is 170 minus 100, it should be 70 kgs or kind of that. So each one of us can know what is our ideal body weight. Just to emphasize again, your height in centimeter minus 100 tells you about your ideal body weight. So it's good to keep normal body weight. That's the best thing to prevent fat liver.
Right, doctor. Thank you so much for telling us a little more about it. If you can also explain abdominal bloating. We have a question on YouTube on abdominal bloating. Why is it so, and how can it be diagnosed and prevented?
So bloating is a symptom of I feel a lot of people, almost one third again, will feel after meals there's a bloating, fullness, and this is common. This is common, and I would say this is physiological. But and within next 20 minutes to 25 minutes, or say 45 minutes, the bloating will decrease, right? So this is normal after once you take meal, the bloating is a normal phenomena. But many people feel as abnormal, right? So this is a condition called dyspepsia. And
Malady.
we ask patient multiple questions and then treat them. The simple drugs available, we can treat them simply.
Uh, is dark stool, doctor, a significant reason to suspect gastro problems? Is it one of the
Dark
causes?
stool, if is a yes, if it is a black in nature, it means it's a blood. Is a serious. The black stool can also occurs in those people who are taking bad tablets, or if they can beet in the diet. Uh, beet is a kind of vegetable, so that can lead to red stool. But without that, if somebody has red stool or black stool, this may suggest there's a bleeding in the stool, and they must be investigated.
Right, doctor. I'm taking my last question now for today because we're running out of time. Can painkillers affect ulcers? Is it right to keep taking painkillers to prevent pain of ulcers? What should be done in case such a situation arises?
Now, yes. So NSAIDs, the painkillers of two kinds. One is called NSAIDs, like disease drugs like combiflam or so, or one such drugs. So these drugs can injure GI tract and lead to ulcers. If you're taking water tablets for once in a while, not a problem. But somebody is taking drugs continuously for some joints pain or so, then that can damage small intestine and large intestine, and also the stomach. So, but it all depends upon that do we want to give somebody NSAIDs? If so, then we do some other thing. There's a bacteria called Helicobacter pylori in the intestine. We try to eradicate that. But again, don't take long term painkillers without prescription by a doctor. Just taking over the counter painkillers may not be good. We always give painkillers for some joints elements, but that's for medical reasons.
Right, doctor. One more question I can quickly take with you, with your permission. What are the first signs of liver damage caused either by alcohol or by any other cause? What are the first signs, doctor? How do you know that your liver is actually damaged, if you could tell us?
I, I think we should be very grateful to God that the God has given us a liver. We require this much liver, and God has given this much liver. 5 times more. 5 times more than required. And that this 5 times liver is called reserve capacity. So, so liver damage will not manifest immediately till the liver is damaged to this much, right? So there are no early signs of liver damage. Liver damage symptoms comes much later, and that when the signs comes, the we can't revert the disease back. So liver damage is a permanent